Lifestyle changes has to be made to normalize your stomach activity. So yeah, not much changes are needed in your lifestyle. I would say restrict yourself to the quantity of food you are eating at a time. Don't have heavy meal at all the time. Don't fill your stomach with heavy food all the time, and do a lot of physical activity. Move yourself, sweat yourself, start doing some of your physical activity, and eat rich of high fiber food, because high fiber diet gives a better life for your GI system. It helps in digestion, it helps in gut motility, and drink plenty of water. I would say 3 liters to 4 liters per day, and for every meal, give enough time for the digestion to happen. If you start a meal say at 9 o'clock, then your next meal should be somewhere after 5 hours. Make it in that way, because the stomach needs 5 to 6 hours for the digestion to happen, and for the gut to clear off the water, for the gut to clear off food you have taken. So it takes minimum time for the stomach to digest the food. Before that, before the digestion happens, when you start loading it again, there is excessive calorie intake and there is overloading of stomach. This happens, there might be some hormonal changes within the body, which in turn leads to some other complications related to GI. So give it enough time. Give it enough time for the stomach to digest your food. This plays a major role. What time you are eating plays a major role. Within the gap of how much time is your next meal, when you are eating, I mean to say, after how many hours you are eating, are you giving your digestive system enough time to digest the food you have taken previously, or you are overloading it, has to be checked out. And what you are eating, as we spoke about, what we are eating includes high intensity of high fiber, high calorie diet. It's a lot amount of fatty food. The basic modifications you can do in your lifestyle are the three things: what you are eating, when you are eating, and how much you are eating. Just put an eye on that. That will help you in changing your lifestyle, which in turn helps in maintaining your GI function. And I would say these things don't happen in a day or two. You just need to practice it. Some might take a week, some might take a month. You just need to be consistent. You just need to follow that, because you are the person who you need to train your body and your GI system. Until and unless you don't